Have you heard about Thurner syndrome, also known as MTS? This rare vascular condition is a bit of a medical conundrum, and today we're going to shed some light on it. Thurner syndrome is a fascinating condition where one of the body's highways for blood, the iliac vein, gets compressed by a neighboring artery in the pelvis, the iliac artery. This compression can lead to a host of circulation issues. It's like a traffic jam in the body's circulatory system, where the blood struggles to get past the congestion, often leading to swelling and pain in the affected leg. Interestingly, this condition seems to have a gender bias. It's more commonly diagnosed in women. But why is this the case, you might wonder? Well, the exact reasons are still under investigation, but some theories suggest hormonal factors or anatomical differences might play a role. Now you might be thinking, a bit of swelling and pain, that doesn't sound too bad, right? Well, while those are the most common symptoms, there's a more sinister side to Thurner syndrome. If left untreated, the condition can lead to a blood clot, known as deep vein thrombosis. This clot can potentially travel to the lungs, causing a life-threatening condition called pulmonary embolism. You see, the stakes are quite high with Thurner syndrome, which is why it's crucial to diagnose and treat it promptly. But, as is often the case with rare conditions, awareness and understanding are the first steps towards better management and treatment. Now that we understand what Thurner syndrome is, let's delve into a recent news event where this condition has been brought to light. Recently, news broke out about Republican Representative Lauren Boebert's diagnosis with Thurner syndrome. So what happened? In the early days of April 2024, Lauren Boebert, a representative from Colorado, experienced severe swelling in her left leg. Concerned about this sudden symptom, she promptly sought medical assistance. After a thorough examination, the doctors diagnosed her with an acute blood clot, which they identified as being caused by Thurner syndrome. This rare vascular condition occurs when an artery compresses a vein in the pelvis, leading to circulation issues. It tends to be more common in women. Upon diagnosis, the medical team quickly devised a plan to address Boebert's condition. In order to alleviate her symptoms and prevent any potential complications, the doctors decided to perform a surgical procedure. The surgery involved the removal of the blood clot and the insertion of a stent. Stents are commonly used in the treatment of Thurner syndrome as they help to improve blood flow by keeping the compressed vein open. Boebert underwent the surgery successfully, and her medical team expressed optimism about her recovery. They expect her to make a full recovery without any long-term health effects. It was also stated that patients with Thurner syndrome can typically resume normal activities after a brief recovery period. While the entire episode was undoubtedly stressful for Boebert, she faced it with courage and determination. She expressed her gratitude towards her medical team and shared her eagerness to return to her duties in Congress soon. Despite her health setback, she remains committed to her role as a representative and her ongoing campaign in Colorado's 4th Congressional District. Boebert's diagnosis has brought this rare condition into the limelight. But how is Thurner syndrome treated? Thurner syndrome, though rare, is treatable. How did Lauren Boebert's medical team address her condition? The journey to recovery from Thurner syndrome often involves a series of treatments. The most common ones include the use of stents, blood thinners, and thrombolytic therapy. Each of these treatments plays a vital role in managing the symptoms and preventing potential complications. Stents are tiny, expandable tubes that are inserted into the compressed vein. They act like scaffolding to keep the vein open and improve blood flow. This is a crucial step in treatment as it directly addresses the root cause of the syndrome, the compression of the vein by the artery. Lauren Boebert's procedure involved the insertion of a stent, a common intervention that has proven effective in many cases. Blood thinners, also known as anticoagulants, are another key part of the treatment. They reduce the ability of the blood to clot, preventing new clots from forming and existing ones from getting bigger. In the case of Thurner syndrome, this is especially important as it lowers the risk of serious complications like deep vein thrombosis and pulmonary embolism. Thrombolytic therapy, on the other hand, involves the use of drugs to dissolve blood clots. This treatment option is usually reserved for more severe cases, particularly when there's a significant risk of complications. Lauren Boebert's medical team chose a combination of these treatments, starting with surgery to remove the blood clot in her leg and insert a stent. This immediate step was followed by a recovery period, during which she would likely have been prescribed blood thinners to prevent further clot formation. The good news is that patients treated for Thurner syndrome often have positive outcomes. Boebert's surgeon expects a full recovery, which is a testament to the effectiveness of these treatment strategies. With appropriate treatment, patients with Thurner syndrome can expect a full recovery. What does this mean for Lauren Boebert's future? Following her surgery, Lauren Boebert is expected to make a full recovery. But what does this mean for her duties as a congresswoman? Thurner syndrome, the condition that led to Boebert's hospitalization, might sound daunting, but with modern medical treatments, it's manageable. After the insertion of a stent to improve blood flow and the removal of the clot, patients typically resume their regular activities within a brief recovery period. This is good news for Boebert, who isn't planning on slowing down. She's expressed her determination to continue serving her constituents, fulfilling her duties as a congresswoman. It's a testament to her resilience, a quality that her constituents likely appreciate. Moreover, Boebert isn't just planning to get back to work. She's also seeking a seat in the GOP primary for Colorado's 4th congressional district. This move indicates her ambition and drive, undeterred by health challenges. Her ability to bounce back and continue her political endeavors despite the recent medical scare is admirable. The road to recovery can often be a challenging one, but Boebert's case paints a promising picture. Her surgeon expects her to fully recover without any long-term health effects. In fact, she's expressed gratitude to her medical team, signaling a positive outlook and readiness to move forward. This recovery isn't just about Boebert, though. It's about the millions of people dealing with rare vascular conditions like Thurner syndrome. Boebert's story brings attention to these conditions and the effective treatments available, offering hope and reassurance to those who might be facing similar health challenges. Lauren Boebert's diagnosis and recovery serve as a testament to the effectiveness of modern medical treatments for conditions like Thurner syndrome. Her story underscores the importance of medical advancements, the resilience of individuals facing health challenges, and the potential to continue pursuing one's goals despite unexpected setbacks. Today, we've learned about Thurner syndrome and how it has recently impacted the life of Congresswoman Lauren Boebert. This rare vascular condition, more prevalent in women, occurs when an artery compresses a vein in the pelvis, leading to circulation issues, and can result in severe complications like blood clots. In the case of Congresswoman Boebert, it led to the formation of an acute blood clot, which required immediate medical attention. The treatment for this syndrome, as we've seen, can involve surgery to insert a stent and improve blood flow, along with medication to thin the blood and dissolve the clot. These treatments were successfully applied to the Congresswoman, with her medical team expecting her to make a full recovery with no long-term health effects. This experience has presented a temporary challenge for Congresswoman Boebert, but it also underscores the resilience of those who face rare medical conditions like Thurner syndrome. Her prompt medical intervention and expected recovery offer a beacon of hope for others dealing with similar health concerns. We hope this information has been enlightening. Please remember to like, share, and subscribe for more content like this. Thank you for watching.